My name is ChaQuana McEntyre Jones. I am the executive director and founder of Family Rise Together. We serve in the state of Minnesota, focusing on St. Louis County, that is both North and South St. Louis County.
What do you feel has been the most meaningful part of this work, and what community impacts have you witnessed thus far?
Well, the biggest one that we did not plan for Family Rise Together. So, a little bit about Family Rise Together. We have five major programs in the three industry: housing, mental health, and economic development. And in our housing program, LTH and housing stabilization, we mainly have a lot of women working for us, but our main target audience are men, preferably Black men who've previously been incarcerated, who have gone through their trauma of being removed from their children's lives, either because of child protection services, because mom has moved on, because of incarceration, or because of his poor decisions. We had a situation where there was a gentleman who lived in our program, and a therapist, a contracted therapist, asked him if he felt suicidal, and he completely shut down. And he was a white male, right? But he identified with the Black culture, preferably the hip hop culture. And so he kind of just shut down, and we didn't know how to get him to open back up, except for the weight was falling on me. I can't come to the rescue every time. We need to get more people trained. I have a master's in child protection, so in social work, focusing on child protection services and therapeutic services. I'm a straight shooter. It's like, let's get to it. If you're not feeling well, I will sit with you. We will come through this. We will do all these things. But everybody does not have that approach to doing the work with the men that we're trying to serve. And so I was like, okay, fine, we'll just do this suicide awareness training through St. Louis County Public Health and Human Services. And we went there and they did this amazing training. And I looked at them and I said, and then what about Black men? Because in the state of Minnesota, Black men are committing suicide at 300% the rate that they ever have. And though it is still way less than their counterpart of white men, we have to understand that we are losing our resiliency as a people, as a Black people. We are losing our resiliency, the very thing that has held us together for generations through before slavery, during slavery, and now after slavery. And we are how many generations past slavery, and our kids and our grandkids are losing their resiliency. And now our fathers and grandfathers are losing their resiliency at a rate that they're committing suicide. Not because they went to war, not it's simply because they are living, they're trying to live in the state of Minnesota where their skin is a weapon, all while they are simply trying to live. So I decided I have my staff do this training. And what came out of it was, you all need to do better. And this is what I told public health human service workers. I'm like, this is not working. You all did not speak to anything cultural that I am trying to get my staff to understand when it comes to Black men and suicide awareness. But ultimately, what came out of it, because of the CLAS grant, Public Health Human Services, we are in conversation to help them redesign, not only help them redesign, but they have taken our thoughts, our feelings, our experiences, and our needs back to the original creators and the licensing agent of that curriculum, and they're redeveloping it, and then also reached into the indigenous community to acknowledge that, okay, we had this conversation with someone in the Black community. This is what they're doing. This is what they share with us. And so we acknowledge that this training is probably not what you're looking for, but it's the best we have. What you're putting out here for my team of white women is not working for the Black men that I'm trying to serve while protecting them and keeping them alive at the same time. So I would say that would be the biggest thing that came out of it, on top of our own policy changes and procedures within our own organization to be more aware of how we're creating policy around CLAS and intentionally utilizing CLAS to create policies and procedures.
Would you say that was one of the most challenging parts of this work? And then how you described how you've managed or addressed this lesson learned? Were there any other ones that you feel were harder than that, or anything else that you'd like to highlight around that?
I think I would say that was the easiest. Honestly, it was learning class. When we applied for this grant, it was like, okay, let's apply for it. This looked like something that can really help us get our policies and procedures in place. And, having funding as a small organization that pays us and gives us time to actually do that was really amazing. And then we dig into it and we're like, whoa, put those pretty little put those pretty little papers down because this is not what we thought it was. We need to go learn this and really study it. So I think learning it and implementing it was the biggest uphill battle for us because now we couldn't just focus on ourselves. I would say learning what CLAS was, the benefit of CLAS, and then implementing it to where I can implement it within my own organization and my staff not felt like it was something new that they had to learn and implement. I wanted to figure out how to ease it in there and not make them feel like I felt like as I was learning what CLAS was and how to implement those policies and procedures.
If you could go back in time to when you started your health equity work or disparity reduction work and give yourself some advice, what would you say?
Hire another contractor. I would say be ready, have somebody on board and have someone in mind. Being intentional about remembering who's in my network is so important because I've met so many people, but then I get zoned in on what I'm doing that I forget about this outward network. And so being intentional about knowing who's in your network and knowing when to use that network to do this type of amazing work is imperative.